Hello everyone. Topic for today's discussion is periodontal disease or oral problems in diabetes. The periodontal disease is chronic inflammatory disease which destroys the structures including the tissues which surround and support the teeth. Sometimes if it is not diagnosed on time, not treated on time, that it can lead to loss of the tooth. The periodontal disease involves the periodontal ligament and the alveolar bone also. If anybody has diabetes, then it will predispose to development of severe periodontal disease, and the risk of the development of periodontal disease increases threefold in any patient with diabetes. This risk again increases significantly when the level of HbA1c in such diabetic patient is more than 9%. Periodontal disease has two-way relationship with diabetes. It means if anybody develops diabetes, then there is increased chances to develop periodontal disease. Subsequently, if anybody develops any inflammatory response along with the periodontitis, then it has negative impact on the diabetic control. It is also found that the prevalence of renal and cardiac complications are higher in individual who is having diabetes as well as severe periodontitis. Dental and oral problems are common in any patient with diabetes, and the relationship between the dental problem and the diabetes is bidirectional. It means if anybody develops diabetes, means poor diabetes control, that will lead to development of dental or periodontal diseases in such individual. Similarly, if anybody develops dental disease or periodontal disease, then this will lead to development of autonomic neuropathy, dry mouth. This will decrease the immunity as well, and ultimately this will predispose to development of diabetes. Let's now discuss what are the common oral problems in any patient with diabetes. The first common problem is gingivitis. Gingivitis is a common and mild form of gum disease that causes irritation, redness and swelling of the gingiva. Gingiva is the part of gum which is around the base of the teeth. The second common oral problem is periodontal disease or periodontitis, which is the infection and inflammation of the tissues surrounding and supporting the tooth, which includes the periodontal ligaments and the alveolar bone. The next common problem is oral thrush. Oral thrush is slightly raised creamy white sore patches on the tongue. It is also known as oral candidiasis, which is a form of infection of the fungus known as Candida albicans. The next common problem is xerostomia, also known as dry mouth. Xerostomia can be defined as the sensation of oral dryness. In this, patient usually report mouth dryness, oral burning, swallowing difficulty and decreased or altered taste. Here in this picture, we can see how the patient of a xerostomia presents. The next common problem is the dental caries. Dental caries is a prevalent chronic infectious disease of the carcinogenic bacteria, cariogenic bacteria, which metabolizes the sugar to the another acid. This acid over the time demineralizes the tooth structure and ultimately causes the weakening of the tooth along with the formation of cavity inside the tooth. Here in this picture we can see how a patient of dental caries represents. Now let's discuss about the pathogenesis in any patient with oral problems. It is found that the degree of hyperglycemia is correlated with the severity of any periodontal disease, It means if the hyperglycemia will be the severe, then the representation of the periodontal disease will also be severe. In any patient with diabetes, the main mechanism behind the destruction of these periodontal tissues is due to the hyperactive immune system, which is common in diabetes. Now, in this diagram, we can better understand the pathogenesis of oral problems. So, in any patient with diabetes or hyperglycemia, which can be a sequelae of obesity, there are multiple factors which are generated, which includes adipokines, the advanced glycation end products, and receptor for advanced glycation end products interaction, the production of unregulated cytokines, the alteration in polymorphonuclear function, and alteration in the apoptosis. This all will lead to development of periodontitis. Apart from that, if anybody is a chronic smoker, then it is found that there will be dysregulated inflammatory response in such individual, which will again lead to development of periodontitis. If there is sublingual biofilm formation, this will lead to generation of pro-inflammatory cytokines and the matrix metalloproteinase, which will again lead to development of the diabetes or flaring of in the condition of the diabetes. As we know that the clinically periodontal disease mainly represent as gingivitis or periodontitis. As we have already discussed that gingivitis is the inflammation of the gingiva, and gingiva is the part of the gum around the base of the teeth, and the gingivitis is the condition which is a reversible condition by the oral hygiene regimen. However, the periodontitis is the extensive inflammation which can lead to tissue destruction and alveolar bone disruption. If the periodontitis is severe, then it can be represented as edema, bleeding, the gingival recession, and sometimes it can lead to loss of the tissues which support to the tooth, and it can lead to the tooth mobility and tooth loss. So, what should be done in any patient with diabetes? If anybody develops unexplained deterioration of the glycemic control, in such kind of individual, we need to look or search for the development of any dental or periodontal diseases, and it is advisable for the patient with diabetes that they should have dental checkup at least once in a 6 months or more often. What are the preventive methods we must follow? The early detection of the periodontal disease avoids the irreversible tissue loss. Oral hygiene must be promoted among the individuals with diabetes. The plaques and caviculae attached to the teeth must be removed in every 6 to 12 months. The on-time and adequate treatment of periodontal disease improves the glycemic control. It is found that the adequate treatment of periodontal diseases reduces the HbA1c level by the 0.4%. Now let's summarize to this presentation. The diabetes predisposes to development of severe periodontal diseases. The periodontal diseases are chronic inflammatory diseases which destroy the tissues that surround and support the teeth. The early detection of this periodontal disease can avoid the irreversible tissue loss, and oral hygiene must be promoted among the individuals with diabetes. Thanks for watching this video. Please like and share this with others.